Norman Scherzer from the Life Raft Group.
So the story of the Life Raft Group started in the year 2000. It started with a clinical trial, a drug called Gleevec, when my wife Anita, one of the first 30 patients, had metastatic cancer. She had weeks to live. In fact, before the trial started, we brought our family together to re-exchange our wedding vows so that she could say goodbye. 30 days into the trial, radiologist comes running into the room. Slides are up on the wall. Norman, I've never seen anything like this in my life. Half her tumors are gone. The rest are dissolving into liquid. And that was the start of the beginning of a patient advocacy group using targeted medicine and mutational testing to increase the survival rate of patients with a cancer called GI stromal tumor. So the Life Raft Group, since that time, has identified, with the help of a number of researchers, a number of subsets to GI stromal tumor. That's the Life Raft Group. And those are all GI stromal tumor cancer survivors. We have some unfinished business. One of the subtypes of cancer that we have not yet found an effective treatment for affects children and young adults. Let me introduce you. This is Elisa. This is what we pledge we don't want to happen to Elisa. We never want to see an empty swing in a park with a rose on it again because we were unable to finish our business. So what were we going to do? Well, we decided let's bring together a group of consortium partners with a couple of caveats. Let me introduce the group. Several other patient advocacy groups, and probably about 16 or 17 of the leading specialists in this particular subtype of cancer in the world. We met several weeks ago in Miami, Florida. We pledged that we were going to keep people like Elisa alive, but there's some catches. And one of the things I want to explain is anyone can bring together a consortium of people. The trick is to make the consortium work. And I think what helps in this situation is that a patient advocacy group like us, we become the honest brokers. We enable researchers who used to compete to share information. And so we have some caveats for researchers who want to join our consortium. You must share information. You must be willing to share tissue. You have to be very smart, with one exception. We want to make sure that you failed medical arrogance in medical school so that you can get along. While I have 6 seconds left, my thanks to Sarah Rothschild, the mother of 4 children who was able to bring this group of difficult individual researchers together. Thank you, Sarah. Thank you, Life Raft Group.